The future of healthcare, what does that look like? This is a question we've been in a practice working with clients on over the past year. There is a lot of change going on, and we've been working with over 10 organizations in the province, helping them imagine their future in their facilities and organization going forward. We've seen over the past year a number of categories which constantly come up as an area where change is most acute for our clients, and we're working together with them to help understand these changes and how they impact the future of healthcare delivery.
We're hearing a much stronger desire to focus on whole health, so the impact of material and finish selections on occupants of healthcare spaces, but also the manufacture of materials and finishes. More demand for health product declarations, and these becoming more readily available from manufacturers.
As I look ahead, I'm excited to find new ways for data analysis tools to inform our healthcare planning. For more complex projects, and these are typically those looking at multi-site healthcare campuses, we can partner with our digital practice group to develop custom, data-driven modeling and analysis tools. When we build these models with flexibility in mind, they can be effective tools even beyond the life of a project.
As we look forward, we need to design for the whole patient, not just what will make them medically better, but will make their whole person better. And to do this, we need to talk to them. Every patient and family has a different situation and experience, and we need to hear these diverse perspectives in order to be able to design for them. Architecture may not be able to cure an illness, but when it comes to the healing journey, that's where we can make it more hopeful and less stressful for patients and their families. Doctors are concerned about healing the physical body, and rightfully so. But when it comes to the patient experience, that's where architecture comes in. That's where we can have an impact and support the way care is delivered. You can see this in our work with SickKids on their new patient care tower. We're actively engaging patient and family advisors to help us design their new hospital.
We're seeing a lot of focus on energy efficiency and carbon reduction. Climate change is the defining environmental crisis of our time. We have the Greenhouse Gas Pollution Pricing Act in place now, which puts a price on carbon, and that's driving a lot of innovation. For instance, wastewater energy transfer. I think this is just going to continue to grow into the future. Another area where I'm seeing a lot of movement is the WELL building rating system. So we had the opportunity recently to do a deep dive into WELL with our clients Niagara Health on the new South Niagara Hospital, which will be the first hospital in Canada to achieve WELL building certification. You can think of WELL as kind of a toolbox for the design and operation of buildings that care for their occupants. I think that WELL is a great fit for healthcare, and I think there's going to be a lot more interest and uptake into WELL in the future.
When we think about infection control and healthcare design and change, it really is an issue about pivoting. What were in the past guidelines have been validated and now have become mandated in many cases. Our clients need to be able to change how they operate, how they deliver care based upon what's required of them at the time to keep us safe. And we need to help them design a building that allows them to do so.